When you get to the clinical setting, usually it's a day or two later. If it's within that first 48 hours, your concerns are still the same. Your job as a clinician is to identify red flags. Does this patient have any red flags that would require emergent neuroimaging? Does this person need a CT scan to rule out a bleed, a fracture? Does this person have potential spinal cord injury? Are they complaining of numbness or weakness in any of their extremities? So these things still have to be very much top of mind in that first 48 hours. So if you are doing a clinical assessment, you're going to start with any clinical assessment. You're going to start with your history. You're going to ask, are they getting worse? Are they getting better? You're going to look at cranial nerves and neurological examination. You're going to look at visual tracking, looking for abnormalities. These tools are not to evaluate concussion. These tools are to evaluate the integrity of the cranial nerves and the brain structure. If there's any abnormalities, then this person should be going to emerge to get imaging. The basis of your cranial nerve screen, it should be normal, right? Your cerebellum screen should be normal. If it's not, then you're sending that person to emerge. So your in-clinic examination is history, neurological examination, and then again, assessing for things like cognitive capabilities. Some people will do a baseline retest if they have it. I typically don't do that unless I'm really unsure if there's been a concussion or not. Typically, if the person has a mechanism of injury, meaning they've been hit, and they have any one of the 22 signs or symptoms of concussion, that is a concussion. There's no need to do any advanced testing. Your job now is to see, do they have something more serious? If so, I need to send this person to the hospital. If not, I can then continue with my plan of management. And my plan of management would be first following the steps of return to learn or return to work, and then followed into return to play. So you're going to put them on your kind of moderate symptom-limited activity. Then you're going to gradually progress into light cognitive abilities and things like that. And you're just going to monitor for symptom increase or decrease throughout that process.